Okay, so I'm going to be doing the video for catheterizing a female bladder. So I already reviewed the patient's medical record, making sure there's an order from the doctor to insert the indwelling catheter. I'm going to show you really quick. I gathered my equipment, so I have my wash basin and I have my foley kit and I have my patient. I prefer hand hygiene. I just need to put on my gloves.
Go on the side. So I'm going to be on this side.
So first I'm going to be washing the patient and then preparing the catheter. So the patient, I already assisted her into the correct position, so her legs are, she's in a dorsal recumbent position, legs are slightly spread with the knees up. So there's room to perform everything. Okay, so I draped the patient so only the peri area is exposed. There's a waterproof pad underneath here, and I'm just going to clean the patient. So on either side of the labia from front to back, and then with a new side of the washcloth each time on each side. And then down the middle. Okay, just going to dry the patient off, pat dry.
Look at all this. Is that? Yeah. Okay, so you're going to let me line the patient.
Okay, so I can take my gloves off and perform hand hygiene.
Water right here set aside. Oh, you know what?
Okay. So I have my catheter kit and open it up away from me.
Have the water set aside. Give them the tray just complete. So you have the bag flex to it. And then you have.
And I can use the bag as a garbage can, but I do have one next to me, so I don't use. I won't use that. And since this kit comes with the drainage system attached, I don't have to set up a drainage system separately and attach it, but I would if this was a different kit. So I'm going to open the sterile catheter kit away from me.
You guys can go through this.
And I'm going to put on my sterile gloves.
Oh.
Okay, so now I'm going to be putting the sterile drapes on the bed. So at the corners of the white one.
Huh?
Take the shiny side down. Okay. And then the blue one as well, just to extend the sterile field.
Oh, that's so cute.
Okay, and we don't need the fenestrated drape, so I'm not going to use it today. So I can put my catheter kit on the sterile field near the patient. Okay. I'm going to apply the iodine to the cotton balls. since the patient is not allergic. So pour them over the cotton balls. Discard. Open the loop, pour that on to the kit as well. And hook the sterile saline up to the balloon port in the catheter. I can also put the catheter tip into the loop so that it's prepared for when I'm ready for it.
Okay. So before you begin, you're going to have to measure to see how far down you have to go, and then you're going to have 2 pieces of tape prepared already.
Okay, so with my tweezers, I'm going to take the iodine cotton balls, and with my non-dominant hand, this is going to be my contaminated hand now, I'm going to spread the labia and then clean the patient on each side. So from top to bottom on the left,
and then you'll place a tape
discard the cotton ball, top to bottom on the right,
yeah, just start with it. So you place a tape on your tube,
discard the cotton ball,
place a tape on your tube,
and down the middle.
That, give the patient the water so they already know. Tell them what's going to be going on.
And now I'm ready to insert the foley catheter. So close to 1 to 2 inches from the tip of the catheter, going to slowly insert. I'm going to instruct the patient to take a deep breath because there will be some pressure, and insert until I see a return of urine.
As I continue to insert the tube, and if the patient, if you see them turning purple or blue or a different color, immediately stop the procedure and remove the tube. And after that, you have another piece of tape. The tube is going to want to start retracting back, so you place the tape, put the untaped, the cut strip on here, the uncut strip on here, and then put it down. And then
okay, so once I see a return of urine, I'm going to advance the catheter to 1 to 2 more inches.
The tube is properly in place.
And then I'm going to
X-ray, check the pH.
Inflate the balloon with the syringe.
You can measure the. You can measure the rest.
And at this point, I would remove my sterile gloves and I would
to see how much is inserted
attach the foley catheter mostly to the leg of the patient so it doesn't come out. And I would also check to make sure there's resistance when pulling up lightly on the foley catheter. I would take the drainage out of the bag, or the bag out of the box, and set it below the bladder so that it drains. And then if I needed a urine sample, I would take it immediately from the bag. But after that, you would take it from the
after
port.
you make sure that it is in place, you secure this, secure the tube, close out.
So if we were going to be taking the catheter out, I would perform hand hygiene and put on gloves.
You can secure it to the gown, because if you place it on the better and in case someone yanks on it, then it's going to... You can secure it onto the gown, and then if needed, you can also secure it onto...
So I'd attach an empty syringe and allow gravity to deflate the balloon by pulling the saline up. I would discard of the syringe. I'm going to instruct the patient to take a deep breath. There will be some pressure, and I'm going to pull the foley catheter out. And wrap it in the chucks underneath, and I would clean up. Okay, so I reviewed the patient's medical record, making sure there's an order for the indwelling foley catheter. I knocked on the door, and I already performed my hand hygiene, introduced myself to the patient. I'm going to check the name band. So, could you tell me your name and your birthday? Okay, name and birthday is confirmed. There's no allergy band. So, do you have any allergies to iodine or latex? No. Okay, so no allergies. Introduced, and I'm going to explain the procedure. So I'm going to be inserting a foley catheter today. It might be a little uncomfortable, but it's more just pressure, and then just take deep breath throughout the procedure. This is because you are retaining urine, and this has been ordered by the doctor. So I'm going to adjust the bed to a working height. That is comfortable for me. Okay, so I can sit him up a little bit so it's comfortable. Okay, that's good. Okay, so I'm going to dispose of the blankets down, put some gloves on.
How's it going, Sandy?
Expose penis. Put a waterproof pad underneath. Lift your butt. Okay. Straighten out the legs. So I'm going to be cleaning the patient. So take my washcloth with the water and soap. Mitt, non-dominant hand, circle down. Change sides. Circle down. Get a new washcloth. Circle down and change sides one more time. And clean under the scrotum down to the anus. Okay. So now he's all clean. We're gonna dry him off. Hat dry. Discard of my gloves. Perform hand hygiene. And now set up the sterile field. Okay, and I have a garbage can for garbage purposes. So, open the catheter kit. Use this as like a little garbage for myself.
Knock, knock. Oh.
Get rid of this. So I would open away.
Yeah. Yep. Yep.
Turn away. Turn away. And away. So now that's open. Take my sterile gloves that was in the thing. Put my sterile gloves on. Cup in towards me. Making sure not to have my back towards the field.
Female and male.
So non-dominant hand.
So female and male foley is in one video.
Fingers.
Female and male in one video.
And adjust. Okay, so now we're sterile. Alright, so now we're going to place the drape. The shiny side down. Airplane the drape. No. Okay. I'm gonna take the blue drape. This is to extend the sterile field. Alright, and then we don't need the fenestrated drape, so we can just toss that. So now we can put our kit onto sterile field here. This is all sterile. Okay, so what I'm going to do, since the patient is not allergic to iodine, I can use the iodine solution. And I'm going to open this, pour it all over the cotton balls, and discard. I'm going to open the lube, pour the lube on here, discard. Take my saline syringe and insert it into the balloon port. I'm going to to clean the patient, so I'm going to take the penis with my non-dominant hand, and with the tweezers, clean the patient with the iodine solution. So around, down, garbage, around, down, garbage, around, down, garbage. Okay. And with my sterile hand, take the tip of the catheter about 1 to 2 inches. Instruct the patient to take a deep breath. You might feel some pressure. Just keep taking deep breaths and insert the catheter into the penis. And if there's resistance, you would just twist the catheter if needed. All right, and you would insert the catheter to the Y portion. I can't because it will go way farther. And then you would blow up the balloon and take the syringe off and discard of that, and then pull out the catheter until there's resistance and it doesn't come out anymore. Then you would secure, well, you can take your sterile gloves off, and then you would secure the catheter with some, leave some room, I guess you could say, so that the catheter is not pulling on one end, and secure the catheter to the leg with the Y in between, and then put the Foley bag below the bladder end and let the urine drain out. And to remove, we would just let the water gravity drain out for the balloon, and we would instruct the patient to take a deep breath and pull out the catheter slowly and discard of contents.